Today is April 29th, and this is COVID-19 Local Impact Ottawa Valley. I'm Trevor Riley. Here's a look at the COVID-19 situation. At the latest update, we had 15 confirmed cases, 1 death, and 12 resolved cases here in the county. Total tests done now sit at 1,533, and negative tests now sit at 1,467, and we are currently awaiting the results of 51 tests. Now, as we shift things and take a look at the province of Ontario, the number of cases went up by 347, bringing it to 15,728. That is a 2% increase from the last report. 996 deaths have been reported, along with 9,612 resolved cases. And total tests increased by over 11,000 yesterday, now reaching 264,000 people. Those numbers are from the current update at 10:30 a.m. on April 29th. Today we are going to be speaking with the team from the Deep River and District Hospital to get an update on the preparation and continued efforts as the COVID-19 situation develops. First, I'd like to welcome President and CEO of the Deep River and District Hospital, Richard Bedard, to share an update.
In response to the COVID-19 situation, the hospital set up Emergency Operations Center in mid-March. The Emergency Operations Center meets daily to review and to plan for all activities and operations, including the hospital, Four Seasons Lodge, and the North Renfrew Family Health Team. In addition, this group is overseeing and coordinating clinical care, staffing, and logistics to ensure we can respond to the pandemic. This planning and response is being done in close coordination with regional and provincial partners and is based on direction from the Ministry of Health and the Ministry of Long-Term Care. Our physicians and staff are doing a significant amount of work. Everyone has been very responsive in this dynamic environment, and we are adjusting well to every changing condition so that we can safely meet the needs of patients, our residents, and the communities we serve.
Access to PPE and other medical equipment were topics of concern as the demand for the items increased. William Willard, Vice President of Operations, says coordination from the Champlain region and also the community support went a long way in helping to keep the supply stable.
We've been pretty fortunate to work with regional and provincial partners throughout this entire process, and that group, both those groups have been instrumental in ensuring that all providers have supplies. We do have a pretty good stock here at the beginning, and the concern was obviously how quickly we would be going through supplies. So we're fortunate that at the beginning, the province has been very transparent on what supply levels they've got and have been able to access. And they've also put out great direction for appropriate use and conservation. So we were able to put both of those appropriate use and conservation strategies in place at our organization very early in the process. And that's been very instrumental in allowing us to maintain and conserve our stock. In the Champlain region, this group was very proactive in establishing and mobilizing a supply chain group. This has assisted all of the providers in our Champlain region with supplies, information on different supply chains that we can access, and really keeping our entire region up to date with what's going on provincially and more so to our region. We've also been extremely fortunate that our community has stepped up. Our community has been so great through this whole process with their donations and support, not only in the way of PPE, but also bringing in drinks and food and snacks for our care team. So we've been very fortunate, like I said, to have support provincially, regionally, and locally from our community. So we are maintaining, and we're obviously keeping our ear to the ground on what's happening provincially and regionally. But we have, like I said, been fortunate enough to maintain our supply levels and continue to conserve and ensure appropriate use as directed by the province.
For those who don't know me, I'm Catherine Kemp. I'm the Chief of Staff of the Deep River Hospital. And I think we all just want to thank the community for all of their support for all frontline workers, not just those in the hospital. And then in terms of sort of a message for the community, we want to encourage you guys, if you have any health concerns, to call your primary care provider, whether that's your family doctor or a nurse practitioner. If you don't have access to a primary care provider, the community and the region did create this thing called VTAC that you can call, and they'll connect you with either a nurse practitioner or a physician. And don't forget, all of the emergency rooms in our county are open. If you have an acute medical need, please come in. We're happy to see you. We don't want you to wait until it's too late.
Coming up after the break, we will be speaking with Jenna Hodson about the procedures that have been put in place to help protect the staff, patients, and residents at the Deep River District Hospital. We'll be right back. Welcome back. One thing that we'd like to note that the Deep River District Hospital isn't just a hospital, but it also has a long-term care facility as well. And a lot of focus has been in those particular areas during the COVID-19 pandemic. And I want to bring in Jenna Hodson, Vice President of Clinical Services and Chief Nursing Executive, to give us an idea of the processes in place to help protect staff and patients as well as residents.
We've been very busy here in Deep River, preparing to care for whatever type of COVID patients find themselves here in Deep River, and really focusing on ways to reduce the transmission in all the areas of our organization. One of the most significant operational changes we've made here in preparing to handle COVID-19 patients is the segregation of our long-term care operations. So we have a long-term care home here on site. And under normal operations, our long-term care home has regular interactions with the hospital, with crossover equipment, staff, patients, residents, and volunteers. We recognize that with our long-term care residents, this is a really significant risk of transmission to COVID-19. So we've taken very substantial steps to reduce the transmission for the long-term care home on our site. So we've adjusted all of our workflows and operations to ensure that there is minimal to no crossover from hospital staff to our long-term care staff and operations. So this includes a dedicated entry and exit for all of our Four Seasons Lodge staff and a dedicated pooling of staff that is caring for all of our resident needs. So these staff are providing all of the supports and services, and they're not entering into any area of the hospital, and they're working jointly as a team to protect and care for our residents. This was a very significant decision for us, but our team has worked very hard to segregate this entire portion of our operations, focusing really on the safety of our residents and staff with the enhanced risk of COVID-19 in long-term care. So not just in long-term care, but our team's been busy working in every aspect of our operation to prepare for COVID-19 patients here. So very early on, we reduced the risk by designating single points of entry into our organization. And this is to ensure that every person coming into the organization is screened for symptoms of COVID-19. So this allows us to identify any symptomatic individuals very early on and to ensure that precautions are in place for symptomatic patients that are seeking care. So this protects our staff, but also the patients and anyone else in our organization. We actively screen all of our staff, both at the beginning and the end of our shift, so that they can identify anyone that's symptomatic. Also, in alignment with provincial direction, we've slowed down providing any non-urgent or non-essential services, including some of our outpatient services. So this was to ensure that we had the capacity and we'd be able to shift our operations on a moment's notice to focus on care of COVID patients that were coming in from whatever area of the community or into our organization. We've also ensured that our staff were available then to provide care for different kinds of patients should we need to. So we've focused on keeping people well as well with our primary care and preventative care, because that's also important even during a pandemic. And we've been able to shift many of our preventative care services in our inpatient primary care and our outpatient services to a virtual model of care. So this allows us to continue to provide preventative care and follow-up care supports to our patients to prevent them from getting more ill and needing emergency care by having access virtually through telephone or video visits to family physicians, nurse practitioners, dietitians, and other nurses to be able to monitor and provide care. We've shifted our outpatient services like lab and x-ray to an appointment-based, which allows us to space out time between people that are coming in and also ensure we can clean the care environments to reduce risk of transmission. I would say our emergency department team has also been incredibly active in preparing to care for ill patients that may be coming in as a result of COVID. With many adaptations to our environment in the emergency department to reduce risk. And we've been focusing on ensuring that we have all the supports and equipment that we need to provide care. So our team has been working so hard to adapt practices and procedures and be ready for whatever may come through their door.
I would like to thank all the staff that joined me today to talk about COVID-19 and how the Deep River and District Hospital is helping to protect those that matter most. Your TV has been busy all over the province covering every aspect of COVID-19, recording hundreds of interviews, in person or even over the internet, to bring you up-to-date information on communities all over Ontario. But on top of all of this, it's you, the community, residents, family, friends. You are the reason we are here to share and tell your stories and to provide information to help you get through this time. We hope you are safe wherever you may be watching. Remember to catch up with everything that we're doing at yourtv.tv for all our COVID-19 coverage and full-length interviews. I'm Trevor Riley. Thanks for watching.